Now let's dive into an important discussion about uterine cancer. So please join me in welcoming Dr. Ebony Hoskins.
Good morning.
Good morning. How are you, Dr.
I
Hoskins?
am doing well. So glad to be here.
Absolutely. And we appreciate you coming. I mean, this is a conversation, even from our preview, there's a lot of things that women and people around the world just
Mhm.
don't really know about uterine cancer. So I hope that we'll be able to dive into a lot of different areas from your expertise and just things that are important, particularly here in the district.
For sure.
Absolutely. So, well, first, can you just, exactly tell us what is uterine cancer and how common is it?
Well, uterine cancer. So, mainly what we're going to talk about is uterine cancer, which is cancer of the uterus. And most of the cancers, they're coming from the endometrium. So, that's the lining or the same lining a woman would have her menstrual cycle and bleed. And then there's a rare type called a uterine sarcoma, and that's a cancer of the wall of the uterus. So, the most common is endometrial cancer. We're putting them all together in the name of Uterine Cancer Awareness. In terms of the number is rising. We anticipate over 69,000 women will be diagnosed throughout the United States this year. This year, 2025. And small portion of that will be patients who have uterine sarcoma. So when you look at the grand scheme of things, not a large number. When you nail down who's getting it and who's affected, it becomes higher.
Excellent. So, I mean, I want to go to one thing that you mentioned, that uterine sarcoma, because earlier it was realized like that is a common misconception that some people are kind of confused about what exactly is uterine cancer and what isn't. So, can you tell us, I mean, just in general, maybe some misconceptions that you think people commonly hear, especially women, when they think of uterine cancer?
So I think uterine cancer, they think fibroids, leiomyoma, which are benign non-cancer tumors. There is a rare, less than 1% of what is thought to be uterine fibroids that could be a sarcoma, but most likely, in terms of numbers, it's a um, uh, benign tumor.
Mhm.
I think the what I definitely want to relay today is that the lining of the uterus is where the numbers are, and is not related to uterine fibroids. It's not related to endometriosis. It is really the lining of the uterus that can develop a cancer, which we call endometrial cancer. And that is a type of uterine cancer. So, probably most of the statistics that we're talking about today will be heavily talking about endometrial cancer, that lining.
Okay, interesting. So, what are some
Mhm.
of the warning signs that women should be vigilant about?
Right. So, number one, there's no screening test. So, there is no screening test for uterine cancer. Most women who are diagnosed after menopause. And I think I need to define what menopause is because most folks don't know. So, menopause is when a woman has not had a period for an entire year. The average age in America is, say, 52, 53 years old. So,
Mhm.
that's where a large amount of women will be diagnosed after menopause. Any bleeding after menopause is not normal. Let me repeat again. Not normal. So if I'm saying this not just as a patient, but your sister, your cousin, them talk about having bleeding after menopause, it's not normal and it should be seen. That's one of the first signs. Now, it doesn't mean because someone is having bleeding after menopause that they have a cancer, but what it should prompt is that they should be seen. Sometimes there are things what we call endometrial polyp, could be a benign growth of the lining. Sometimes it could be something that is a precancer. I hate using that word because guess what people hear? Cancer. But
Mhm.
they other types of issues that goes on that could be something before a cancer develop, and then sometimes, of course, we want to make sure it's not a cancer. So any bleeding after menopause should be evaluated by a gynecologist, or at least prompted to the primary care doctor. Women before menopause can get endometrial cancer, and those signs are a little bit harder because they could have ultrasound that shows uterine fibroid, but heavy bleeding, abnormal bleeding, things like that should get evaluated and make sure there's no abnormal cells that are growing.
Interesting. So,
Hmm.
my question now, in terms of, maybe there is a correlation. I'm just thinking of there is with UTIs. Are UTIs a sign in any way or any?
Nope. Nope.
Okay.
Nope. Okay, so let me go ahead and I'm about to school you, if that's okay.
School me. Please.
Uterine cancer, we think and we know, is correlated with too much estrogen.
Okay.
Okay. Too much estrogen can occur if someone is the biggest risk factor in America. Why the numbers are going up? Guess what else is going up? Obesity.
Mm-hmm. Okay.
So obese women can still make a type of estrogen. It's not necessarily from the ovary, but a type of hormone that's very similar to estrogen that can stimulate the lining and cause overgrowth. And that overgrowth those cells can change. So obesity, women who may have taken, say, estrogen replacement therapy without a counterbalancing hormone called progesterone. Sometimes some women are taking medications for breast cancer, such as tamoxifen. That's also another estrogen. PCOS. So someone who has abnormal cycles and PCOS is too much estrogen. That is probably the biggest factor. And then I think I have to go ahead and say that there are some people who have genetic increased risk. So things that are associated with colon cancer called Lynch syndrome. I mean, I don't want to be like into the sciences of it, but I do want to make sure that our viewers know,
Absolutely.
kind of what's going on and what the risks are.
Mm-hmm. And I think it's very important to get into the sciences because a lot of times we hear the words and they either sound scarier than they do, or just because we don't know what they mean, we don't realize what they're connected to. So by all means, feel free to school us.
Look, this is what we do all day long. So yeah. I think, in terms of like what I feel like I'm on here to let you know the data, the numbers on the rise, the risk factors, endometrial cancer. And in particular, our audience is primarily Black or African American. They may identify, and obviously others are there, but the women who are being diagnosed, we're diagnosed similar rates as white women, but we're dying double the rate. Mm-hmm. And so, I always look at it and I'm like, why? And I don't think we have all the answers. I think I do see that Black women are diagnosed with more aggressive subtypes. And a more aggressive subtype typically have a higher risk of having advanced disease or metastases.
Mm-hmm. So is there anything specifically in terms of lifestyle changes or just things that women do or can't do that may help lower the risk of developing uterine cancer?
Well, I mean, look, some of it we may not know, but I think keeping a healthy weight, right? Mm-hmm. So if we know that obesity, that's some things that we probably can do. If we know obesity is a factor, keeping a healthy weight, keeping a healthy, hypertension, diabetes obviously is associated with obesity, but a healthy lifestyle and weight. Going to the doctor and being aware and being vigilant. If there's a family history of cancer, and it may not just be endometrial cancer, colon cancer that we are acknowledging, and now we have genetics testing that we could do and delve into and actually help prevent. So there are some things that we can do. Again, there's no screening test, meaning there's no test that we can take to prevent the diagnosis. But, there are some things, measures in terms of healthy lifestyle that I think we can do.
Excellent. And how does, tell me about the Foundation for Women's Cancer. What kind of work do you all do sort of in this field and preventing or helping bring?
Well, we're doing some of it now. So the foundation, I am a member of the Society of Gynecologic Oncology, which is, I believe it's over 33,000 members worldwide. And we take care of women with gynecologic cancers. Our nonprofit organization is the Foundation for Women's Cancer. And our goal is for advocacy, education, which we're doing right now, and then research. And so some things that we're doing, I think that we're doing a great job of trying to get the word out, right? Like we're talking and having this discussion. You've never heard of it. We're doing our job now. And then, in September, we'll have a couple of events coming from the foundation. And one is a big race run to help raise funds for research for gynecologic cancers. That'll be here in September. I would love for you to invite me back in case to talk about that. But anyway, you like that invite that we? Yeah.
I did. Like shameless plug. We're not mad at it.
That little plug in. But anyway, so I think that we can do a better effort in an even better effort in, uh, marginalized communities, because that's who's affected
Mm.
more.
Excellent. And beyond even, the foundation and of course the Society of Gynecologic, I'm glad I said that word right this time,
Mhm.
Oncology Center. What other support is available for facing these challenges?
Well, I mean, there is a organization called Ikana. That's kind of off the. Ikana is for Black women with uterine cancer. It's a support group that
Mhm.
meets virtually, and I think the other thing that we want to know, there's more work trying to be done on understanding the why, of why this cancer is developed, why Black women are affected more. What can we do? I think we need more money and research and an effort, like actually bringing it, as an effort to study it,
Mhm.
and bringing the information out so we can help save lives.
And do you have maybe an idea of, even though this is one of the commonly most diagnosed cancers, but there is so much misunderstanding and misinformation surrounding it,
Hmm.
and particularly within the community it affects. Why do you think that is?
Gosh, I just think right now we're in misinformation phase,
Mhm.
right? Like, I see lots of patients where they will get their information not from the doctor, and it's not just patients all over, really, quite honestly, that don't get the information for the folks like me that have taken our entire life, if you will, maybe half of it, getting the education, that they will rely heavily on internet.
Mhm.
And I think internet is potentially a good resource, but I've even had folks that said, no, I get my info from TikTok. And I'm like, okay. So some of it is that. Some of that is a historically mistrust in the medical community, particularly from marginalized. I mean, we have the Tuskegee event. That stuff it carries on throughout. Then we have systemic racism. I mean, we have a lot of topics that we can approach into, and I mean, I don't know if we want to go there, but there's lots of reasons, I think.
Absolutely. And of course, we have, a follow up question from one of our viewers that wants to confirm, are there symptoms other than bleeding for uterine cancer?
So I've seen some where you may not have any symptoms, right? It may be an incidental finding on an imaging if someone got an ultrasound or CAT scan. I've seen some women have pain, pelvic pain, but probably the most common is bleeding.
It's common as bleeding. So, and
Mhm.
to clarify, if you don't have a period, like in just the sense of maybe birth control or anything like that, how does that kind of tie in? You know,
How does birth control tie into endometrial cancer?
in the sense of like when you may not be getting a period, but it's not necessarily like menopause, if that makes sense.
Right. So, like, again, majority of women are going to be diagnosed in menopause.
And okay.
If someone's not having a period and they're premenopausal, gosh, that's definitely needs to be addressed by their gynecologist, and we have to consider other things. Sometimes it's hormonal, sometimes it's wait. I mean, there's a slew of things, but I think if I don't say one thing at a time, it would be, seek a GYN provider, seek a primary care provider. If you feel like you're not getting the answers that are needed, seek care elsewhere.
Absolutely. Okay, thank you so much. And is there anything else that you want to bring to this conversation that we haven't talked about or that wasn't asked?
No, I mean, I think the biggest thing is that, one, seek care. GYN care, we think even probably a little bit not better, but some docs don't even, or providers don't even do pelvic exams. We think it's important to do pelvic exams. Um, we think that when things don't feel normal, it's okay to share that or to seek it out. I think, understanding that there are resources in the community to find out more information about this, such as our foundation and others, family history, get it checked out, get tested. And we would love to see you guys join in September 14th, for our walk to end women's cancer. So it's a run walk to end women's cancer. More to come for that.
And we will definitely have you back on to talk more about the event and maybe dive into some of those areas we didn't touch too heavily on today. But I think it's absolutely important conversation, a continuous important conversation. And, I would love to hear a little bit about the research behind, or first what I wanted to ask even from earlier, what kind of brought you into this field yourself?
Honestly, I knew I wanted to go into medicine, but I did we do rotations, and I felt like the patients I saw needed a physician that was more of a patient advocate. At that time, I think it was more patriarchal, meaning more men in the field, and the patients kind of went along with what they said and not really could see what the patient wants. So yes, we are going to recommend things, but kind of tailoring the care towards a patient. And really the idea of I operate, so I'm a surgeon, I give chemotherapy, and we also do research. So when you speak on research, we are working on trying to improve things. So we have clinical trials at my local institution, but then as the foundation, for example, use any monies that's raised towards researchers that may be doing trying to study why Black women, for example, have worse cancers.
Excellent. And I know you mentioned before that here in the district, there's particularly drastic statistics when it comes to that. Can you share a little bit of light about that as well?
Right. So my colleague, and she dug into the statistics. Now we know DC is not a state, but it's the district, right? So DC has the highest incidence rate. DC has the highest incidence rate of uterine cancer, and particularly for Black women. So when you look at numbers, I think it's 36.8 per 100,000 women. That's in the district. And then in terms of death rate, I always have to kind of go back to it. So all women in uterine cancer, DC has the highest rate from endometrial cancer in the nation. And for Black women with uterine cancer, DC has the highest death rate from endometrial cancer in the nation. And then for white women in DC, it's 30th in the nation. So there's definitely a gap, which you may hear is disparity.
Oh my gosh. And I mean, is there anything pointing to why that is, at least specifically here in DC? I mean, we're talking about Black and white women in the exact same region, but that's an entirely different.
Right. You heard the number. So remember and initially in our conversation, we were talking about what types, right? So literally, I'm a real living example. I used to work in Montgomery County doing the same thing. And I would say I saw more white patients, more white women, and they had endometrial cancer, but it was the lower stage, the better behaving type. Moved my practice to DC. I saw more Black women. They had endometrial cancer, but it was a different type. And the type they had was the more aggressive subtype. I think sometimes it's access to care. So maybe someone has insurance, but then getting into the doctor to be seen, getting that appointment. By the time they get it, some of it may be some misinformation. And then there's some studies that say even when we control for the tumor type and the socioeconomic type, there's still a gap in what patients, their outcomes are. So that's the part that I'm trying to understand. I don't know the answer to it all, but trying to understand. This is certainly not the topic for time, but initially it was thought, well, maybe the perms will call. And then I really kind of didn't buy it, but that is a difference between Black women and white women. Even if you control for the same resources, there are some things that we do differently. So I think that requires more work. I'm not going to say at all that is a cause. Could it be probable? Sure. We need more data on it. And I don't know who is going to invest in that to look at it. That's going to be who is going to invest the dollars to look into that.
Absolutely. Wow. That's heavy. That's a lot.
What if you working it every day?
But no, yeah, I can only imagine. But
You're
very
right.
important work that you're doing, and bringing awareness to our audiences. We're happy to have you on as much as possible to shed light on this topic. So thank you so much. I want to thank you for being here. I want to thank you for the work that you guys are doing at the Foundation
Yeah.
for Women's Cancer as well. By all means, like I said, everyone, please check out these links down here, and circle back to this segment to pick up on some things that you might have missed that Dr. Hoskins has enlightened us with today. And like I said, she will be back.
Yeah.
She will definitely be back before the event in September. Remind us of the dates again.
September 14th. Look,
September.
I think it's on a Sunday morning. It'll be down there. I think Pennsylvania Avenue. Yeah, I was just trying to remember it's right next to the Ronald Reagan bed. My brain right now is but anyway, it'll be downtown, 5K walk or run. It'll be a great time and opportunity to meet folks, to learn more, to raise funds for research.
Excellent. Thank you so much for joining us today, Dr. Hoskins.
Thank you for the invitation.
Of course.
Where do you come to get all